Even with the best medicines and care, many people with cardiovascular disease are at risk of suffering from a heart attack or a stroke due to a continuous buildup of fat in their blood vessels, which is driven by the immune system through a process known as inflammation. This buildup of fat in the blood vessels, driven by inflammation, is called atherosclerosis and can restrict blood flow to the heart and brain. At the moment, no treatment exists to manage the inflammation that leads to atherosclerosis. Inflammation is the main mechanism by which our immune systems fight off invaders, such as bacteria and viruses. Inflammation is thus crucial to our survival. However, inflammation can sometimes be bad for us. Untreated, long-term inflammation can cause atherosclerosis, which can lead to cardiovascular events such as heart attack or stroke. Almost half of people who have cardiovascular disease still have long-term inflammation, despite receiving the best therapies that are currently available for cardiovascular disease. This long-term inflammation can put people at risk of having a heart attack or a stroke in the future, and this is known as residual inflammatory risk. People who also live with other conditions, such as reduced kidney function, experience high levels of long-term inflammation, which can contribute to increased residual inflammatory risk. Residual inflammatory risk is measured using a simple blood test called high-sensitivity C-reactive protein, or more simply, HsCRP. HsCRP is not directly linked to atherosclerosis, but it is a good way to measure levels of inflammation in the body that can lead to cardiovascular disease. If you have more than 2 milligrams of HsCRP per litre of blood, and this cannot be explained by other factors such as a recent infection, then you may have residual inflammatory risk. This could increase your chances of having a heart attack or a stroke in the future.